The partners in Kenya are integral to every collaborative effort for global health that I've performed on behalf of the School of Medicine. I have had a number of really interesting projects that I've been really privileged to work with partners on in Kenya. They include the IDEA grant, which was a large HIV research network, and for that particular initiative I worked on prevention of mother-to-child transmission of HIV and helped to identify some safe household drinking water options for mothers who were bottle feeding their babies. I've also worked extensively with the American Academy of Pediatrics on an initiative called Helping Babies Survive. Helping Babies Survive is actually a suite of 3 interrelated educational and training programs specifically developed for healthcare providers in low-middle income settings. They are all designed to address the leading causes of newborn mortality. So the highest proportion of death during the first year occurs in the first 28 days. And we know the 3 things that kill babies during the first month. They're breathing problems, infection, and complications from prematurity. So the Helping Babies Survive programs, each of them are designed to address one of those leading causes of death. Helping Babies Breathe trains healthcare providers on how to deliver immediate care at birth, including neonatal resuscitation. Essential care for every baby is essential newborn care. These are the interventions to detect problems and to prevent problems that are supposed to be delivered to every baby everywhere from the moment of birth until about 24 hours postnatal. And the final Helping Babies Survive program is essential care for small babies. That program has been designed to address the complications from prematurity, such as low body temperature, feeding problems, and prevention of infection. As part of my duties for the American Academy of Pediatrics as the country mentor for Kenya, I often do site visits to large hospitals, not just in Kenya, but throughout sub-Saharan Africa. I left a very large teaching hospital in Kenya after an HBB site visit and was devastated to learn that a kangaroo mother care ward that they had spent a year trying to set up had to be shut down after only 6 weeks. Kangaroo mother care is a very low-cost intervention in which the mother or the father or the grandmother, the adult caregiver, basically serves as the incubator for the baby. The adult caregiver and the baby snuggle bare chest to bare chest, and that baby's body temperature is able to remain very stable, and many of the baby's other vital signs also stabilize. My neonatology colleague, who was Kenyan, was also very devastated. But because the facility lacked sufficient toilets, the mothers that were initially in the kangaroo mother care ward were removing their babies and wrapping them and leaving them on a bed and then queuing for the toilet for 45 minutes to an hour and a half. And by the time they returned, the babies were cold. One of the babies they almost lost. When that happened, the nurses said, "It's too much work, it's not working, you have to shut the unit down." It can't be that lack of toilets prevents this from scaling. So by the time I arrived back in the United States, I had already sketched out the concept for NeoWarm. Then spent the next 2 days actually writing the concept note, and now have developed this biomedical device, which we call NeoWarm, which supports kangaroo mother care. It also has self-warming technology built into the device so that even if the mothers need to take a break, when they put the baby down on the bunk, the baby remains covered, and there's a heating device, and the baby's temperature is automatically monitored. So if that baby's temperature drops just a little bit below the normal temperature range, the heater engages, the baby remains warm. And we recently were awarded a patent for that biomedical device. And many of the projects that students have worked on over the past several years have been related to feasibility and acceptability, stakeholder mapping, landscape analysis, and all of that preliminary work that you need to do when you're designing any sort of global health intervention to ensure that it's actually going to be adopted within the settings that it's developed for. Without these strong partnerships on the ground, it would be absolutely impossible to do this. And through our Helping Babies Survive and our global network connections, we've been able to provide education, training, research, where we've been able to strengthen those missions and really impact change in a very meaningful way in Kenya.